Chronic breast lump. What is the differential diagnosis of chronic breast lump? Sure, when we think about chronic breast lump, the first lump will come to our thinking and to our brain is carcinoma of the breast, which is the commonest carcinoma in female and the most dangerous lump. Carcinoma of the breast characterized by appear in older age, above at least 35 years, with maximum incidence at 50 to 70 years. The swelling sure in this carcinoma is stony hard, irregular, ill-defined, painless, usually single, rapidly growing, and if you palpate the axillary lymph node in stage 2, there is hard, discrete, mobile lymph nodes, and in advanced stages the lymph nodes becomes matted and fixed. Sure, the swelling is fixed to the surrounding structure, and the swelling is felt by the flat of the hand and the finger tips. In addition to the other clinical picture as we take before in carcinoma of the breast, the second common swelling which nearly affect 50 to 70% of female is and considered as the commonest breast disorder in female is fibrocystic disease of the breast. The fibrocystic disease of the breast usually occur in the childbearing period from 15 to menopause to 45 or 55. The swelling is characterized by nodularity, slightly painful or painless, tender, felt by the flat of the hand, felt by the fingertips, not by the flat of the hand, the normal breast tissue, and fibrocystic disease not felt by the flat of the hand, like normal, but nodularity, nodules, small nodules which are multiple cysts in fibrocystic disease of the breast can be felt by the fingertips. The swellings sure not fixed to a surrounding structure. The swelling is characterized by fluctuation of the size of the breast. The breast is enlarged by multiple cysts before menstruation, and these swellings and this enlargement of the breast disappear about 1 week after menstruation. After fibrocystic disease, which is the commonest breast disorder, we will think about benign tumors, hard and soft fibroadenoma. Hard fibroadenoma is usually occurring in young age, 15 to 35 years. Painless, not tender, smooth or lobulated, firm in consistency. Also, it is hard. Its name is hard, but it is actually firm in consistency. The swelling usually single but maybe multiple, slowly growing, ensure the axillary lymph node in this benign tumor is not felt, and the swelling is freely mobile within the breast tissue. And we all know from our previous knowledge, from free mobility of this swelling, it is called the breast mouse. Soft fibroadenoma is usually occurring in older age, from 35 to 55. Painless, smooth or lobulated. Although it is called soft fibroadenoma, it is not soft. Usually not soft. It is usually firm in consistency. Therefore, please correct this in the table. In soft fibroadenoma, the consistency usually not soft. Please correct firm in consistency. And the swelling has restricted mobility because it is large, therefore it has a restricted mobility. The swelling in soft fibroadenoma is usually rapidly growing and may be large. And sure, in this benign tumor, the lymph nodes are not felt. And the swelling is not attached to a surrounding structure. And the swellings, like carcinoma, as any foreign body in the breast, carcinoma, fibroadenoma, cyst of the breast, are felt by the flat of the hand and the fingertips. But fibrocystic disease of the breast is characterized by felt by the tips of the finger, not by the flat of the hand. The next chronic swelling is solitary cyst of the breast. Solitary cyst of the breast usually occur in age about 35 to 55. May be painful, tender, smooth. Sure, it is fluctuant, but it is difficult to feel fluctuation in the soft breast. Therefore, ultrasound is essential actually to diagnose cystic swelling in the breast. Clinically, it is very difficult because the breast is very, very soft. The normal breast is already normally fluctuant. Therefore, it is very difficult to detect fluctuation of the cyst in the already fluctuant breast. Therefore, ultrasound is needed. Usually small and slowly growing. Sure, in this benign condition, the lymph nodes are not felt, and the swelling felt by the flat of the hand and the fingertips, and not attached to a surrounding structure. The next swelling is ductectasia. What is ductectasia? Ductectasia is a condition, there is dilatation of the subareolar or retroareolar ducts, and the ducts becomes filled with tissue debris and whitish creamy secretion. This tissue debris sure invite infection. Therefore, the condition usually in long-standing cases complicated by periductal inflammation. Therefore, the other name of mammary ductectasia is periductal mastitis. Due to inflammation around the duct, there is lymphocytic and plasma cell infiltration around the duct. There is a third name for this disease. It is called mammary ductectasia, or periductal inflammation, or plasma cell mastitis, due to plasma cell infiltration around the ducts. Clinically, the condition usually symptoms, but may present by this: subareolar or retroareolar, painful, tender, warm swelling radiating from the nipple, taking the distribution of the retroareolar ducts. There is also nipple discharge from single duct or multiple ducts, and any discharge may appear in mammary duct ectasia. Here the discharge comes from one duct as this characteristic, the whitish creamy discharge, like toothpaste. And here there are multiple ducts. This is the whitish creamy characteristic discharge. Here there is a duct with clear serous discharge. Here there is blood discharge. The discharge may be serous, blood, or whitish creamy, or yellow, or pus, blood stained, green, brown, black discharge. Any discharge from one duct or many ducts. We should notice that mammary duct ectasia is the commonest cause for chronic and acute non-lactational mastitis and breast abscess close to the areola. Therefore, any inflammation, mastitis in female usually lactating and called acute lactational mastitis and acute breast abscess due to lactation. But if the condition inflammation occur in non-lactating females, any abscess or mastitis in non-lactating female, the commonest cause is mammary duct ectasia. The inflammation may be acute inflammation, but also may be chronic inflammation in the subareolar ducts. And due to chronicity, extensive fibrosis may form, and extensive fibrosis leading to indurated, retroareolar, irregular, fixed tender mass, with shortening and traction on the mammary ducts, leading to the nipple may be retracted, and the extensive fibrosis may lead to skin changes like dimpling and puckering. And here there is important differential diagnosis between mammary duct ectasia in chronic long-standing cases with breast cancer. The differential diagnosis also is carcinoma of the breast with inflammation, which is called inflammatory disease or inflammatory carcinoma of the breast. Treatment is sure excision of the retroareolar ducts through circumareolar incision. Circumareolar incision here, just around the areola. This is very cosmetic, not appear later on. This is scar, and the incision here circumareolar, and the areola is reflected with excision of the dilated ducts. And this is contrast mammography showing the markedly dilated retroareolar or subareolar ducts. Finally, chronic breast lump may be traumatic. Traumatic hematoma. The patient may take trauma now and come to you after many years. Long-standing old hematoma, which may be calcified, and comes to you after many years and forget the history of trauma without any history of trauma. By calcified hematoma, which is irregular, stony hard, similar to carcinoma. Or the traumatic swelling may be traumatic fat necrosis. Blunt trauma to the breast leading to destruction of fat cells, release of fatty acids. Fatty acids unite with calcium, leading to calcium soap, leading to cyst, oily cyst containing oily fluid, or this cyst may be calcified over many years and presenting after many years by hard irregular swelling similar to carcinoma. This is a differential diagnosis and the most important differential diagnosis of chronic breast lump. If there is question about breast lump, you should classify the swelling into acute swelling and chronic swelling. And sure, the most important acute swelling is milk engorgement, acute mastitis, and acute breast abscess, and mammary duct ectasia, which may appear as acute condition or chronic condition. The chronic breast lump include mainly, we think first, the most important is carcinoma, fibrocystic disease of the breast, fibroadenoma hard and soft, solitary cyst, mammary duct ectasia, which may be chronic condition, and the traumatic lesion, which may be breast hematoma or traumatic fat necrosis. What is the management of chronic breast lump? What is the treatment? Treatment of chronic breast lump. How to think? First of all, after clinical examination, is the lump is clinically malignant or not? If clinically malignant, sure, biopsy should be done to ensure the diagnosis, followed by careful evaluation and staging of the patient, followed by treatment according to the stage. This sure clinically malignant and by biopsy treated according to the staging as carcinoma. If not clinically malignant, if patient come to you and by examination it is not clinically malignant, no manifestation of malignancy clinically, we should perform the most important investigations after biopsy. Sure, طبعا. Sure, of course. Digital mammography and ultrasonography. If the swelling is cystic, FNAC, fine needle aspiration cytology. After FNAC, there are two possibilities. The aspirate is clear aspirate. No hemorrhage, no blood tinged aspirate. After aspiration, the swelling completely disappears without any residual mass. Without any residual mass means there is no papillary projection inside the swelling to exclude papillary carcinoma. And cytology negative, no malignant cells. This condition is sure benign condition and it is more enough medical clinical routine follow-up. The reverse, after FNAC, if bloody aspirate, if there is residual mass after aspiration, which means papillary projection inside the mass, which may be papillary carcinoma, and the swelling recurrent very rapidly after aspiration, and cytology show malignant cells. This show malignancy, therefore biopsy followed by evaluation and treatment according to the staging of the carcinoma. If the swelling is not cystic, by investigation by ultrasound and mammography, the swelling is solid. If the swelling is solid with no manifestation of malignancy, re-examine the patient after menstruation. If resolution of the swelling disappears 1 week after menstruation, actually it is fibrocystic disease, and it is enough routine follow up. But if the swelling after examination, after menstruation, persist, or there is any suspicious about the diagnosis, excision biopsy should be done. And this is the treatment of chronic breast lump. Thank you for good listening and good luck.